It was the worst pandemic since the 14th century, since the Black Death. In 1918, a new, more deadly, more virulent form of the flu appeared, the so-called Spanish flu. The numbers are staggering. 500 million people, a third of the world's population, is estimated to have contracted it. An estimated 675,000 deaths in the United States alone over a 3-month period, and some 50 to 100 million deaths worldwide. However, it would be largely forgotten by Americans until the current coronavirus pandemic hit this spring. It is remarkable to think that 100 years later, with all of the advances medical science has made, doctors are giving people very similar advice to that they gave in 1918. Avoid crowded places, wear a mask, and keep your hands clean. The Great War and the 1918 Spanish flu pandemics are inextricably tied together. The first reported outbreak of the deadly flu virus occurred at Camp Funston, today Fort Riley, an Army training camp in Kansas in March of 1918. Many of the over 1.5 million American servicemen shipped to Europe, with plans for 1 million more, surely carried the disease aboard their troop transport ships and spread it first amongst the British and French, later amongst the Germans and the rest of the Europeans. Even the name Spanish flu occurred as a result of the war. Really a misnomer. This flu, which was affecting the United States and other parts of Europe, was first reported in the Spanish newspapers. Spain was a neutral country during World War I, thus had no need for press censorship. The other countries involved worried that news of the flu outbreak in their societies could prove to be crucial military intelligence to their enemies. Eventually, an outbreak of the Spanish flu would be recorded at 24 of the Army's 36 largest camps in America, where some 23,000 soldiers would die. What had caused it? Doctors did not know, so rumors abounded. One article in the New York Times even suggested that U-boats had delivered vials of the flu virus to German agents in America, where it was used as a form of biological warfare. Doctors had no treatment for the Spanish flu, the one thing that surely would have reduced the number of deaths, halting the movement of countless American service members and reducing the overcrowding that many camps experienced, was not done. There was a war to be won. In Wisconsin, an estimated 8,500 people died from the Spanish flu, some 328 in Dane County. Unlike the seasonal flu, where the very young and elderly are most vulnerable, the 1918 strain was particularly deadly for those in the prime of their lives, from age 20 to 40 years old. An H1N1 flu strain, like the 2009 swine flu, the 1918 Spanish flu virus could produce symptoms so severe that doctors mistook them in their patients for not the flu at all, but rather malaria or dengue fever. Those that succumbed to the Spanish flu died when their lungs filled with fluid, which prevented them from getting air. However, as experts are discovering today with the COVID-19 virus, the 1918 flu could be spread by people showing no symptoms whatsoever. Of the 328 that died in Dane County, 39 were students at the University of Wisconsin, 36 of whom were young men enrolled in the Student Army Training Corps, the SATC. Created by the War Department, male students in the SATC were full-time military, living in newly constructed barracks on campus and under military discipline. They even marched in formation to and from classes. Female students who wished to become more directly involved in the war effort were offered a 2-year nursing course, which was seen as equivalent to the SATC. So many students were involved with the war effort at the University of Wisconsin in the fall of 1918 that Dr. Stephen Orrick states that campus, more correctly, could have been called Camp Badger. Indeed, the university and the city of Madison relinquished a good deal of authority it held over its student body directly to the military itself. On October 12, 1918, Lieutenant E.S. Epstein, the Army Provost Marshal of the SATC, sent a letter to all Madison newspapers ordering them to stop publishing all news stories related to the SATC at UW-Madison. Violators were subject to federal imprisonment. 3 days prior, on October 9th, the UW student newspaper, the Daily Cardinal, had reported that Arthur Neth, a member of the Student Army Training Corps, had died, making him the first UW student, indeed first person in Madison, to die from the flu. The pandemic had been front-page news in the Madison papers since the end of September. During the second and third weeks of October, the Spanish flu epidemic was at its peak in Madison. Dr. Orrick estimates that almost half of all working-age adults were out sick during this time. The papers called on those with nursing experience or anyone willing to help to care for the sick. Even high school boys, with school now suspended due to the virus, offered to help. The UW employed 6 nurses to attend to student health, but all were off at the war. In fact, there was a shortage of doctors and nurses across the United States for that very same reason. Vested with broad authority, the Wisconsin State Health Officer, Dr. C.A. Harper, on October 10th had ordered all public gatherings, including movie theaters, bars, schools, and churches to close. This order, however, did not apply to the SATC's activities at UW. As quickly as it had appeared in Madison, the virus passed. While 2 more waves would hit Madison, one that winter and one the following spring, the majority of deaths attributed to the Spanish flu occurred from October 1st through the beginning of December. By December 11th, most public places in town had been reopened. At Forest Hill Cemetery, there are more people who died from the Spanish flu than those who died in combat during the First World War.